The internet has revolutionized access to information. Unfortunately, it has also become a breeding ground for health misinformation. This false information spreads quickly and widely. It can have serious consequences for individuals and public health. One of the biggest dangers of health misinformation is that it can lead people to make harmful decisions. For example, someone might delay seeking medical treatment for a serious condition because they read online that it could be cured with a natural remedy. This delay could have life-threatening consequences. Another problem is that health misinformation can erode trust in healthcare professionals. When people are constantly bombarded with false information, it can be difficult to know who to trust. They may start to doubt the advice of their doctors and other healthcare providers. It is crucial to recognize the seriousness of this issue. We must all be proactive in combating the spread of health misinformation. The impact of health misinformation is not theoretical. It has real-world consequences. Consider the tragic case of a young mother who refused to vaccinate her child due to fears fueled by online misinformation. Her child contracted measles, a preventable disease, and suffered severe complications. In another instance, a man with diabetes stumbled upon a website promoting a dangerous alternative treatment. He abandoned his prescribed insulin regimen in favor of this unproven method. The results were disastrous, leading to a life-threatening medical emergency. These stories are not isolated incidents. They highlight the very real dangers of acting on health misinformation. The consequences can be devastating, leading to unnecessary suffering and even death. In a world awash with information, it is more important than ever to rely on credible sources. Evidence-based information is crucial for making informed decisions about our health. This type of information comes from rigorous scientific research. Medical professionals rely on evidence-based guidelines. These guidelines are constantly updated based on the latest research findings. This ensures that patients receive the most effective and safest treatments. When we base our health decisions on sound evidence, we empower ourselves to make choices that promote well-being. Trustworthy sources of health information include reputable medical organizations, government agencies, and academic institutions. These sources are committed to providing accurate and reliable information. Section 4. Separating fact from fiction, debunking common health myths. One of the best ways to combat health misinformation is to educate ourselves about common health myths. For example, some people believe that eating garlic can cure the flu. While garlic has some health benefits, there is no scientific evidence to support this claim. Another common myth is that vaccines cause autism. This claim has been thoroughly debunked by numerous scientific studies. Vaccines are safe and effective, and they are one of the greatest public health achievements in history. By learning to identify and debunk these myths, we can help to stop the spread of misinformation. When you encounter a health claim online, take the time to verify it, look for credible sources, and be wary of anecdotal evidence. Section 5. Navigating the digital age. Empowering yourself with critical thinking skills. In the digital age, we are all bombarded with information. It is essential to develop critical thinking skills to navigate this complex landscape. When evaluating health information online, consider the source. Is it from a reputable organization or an anonymous individual? Be wary of websites that sell products or promote miracle cures. Look for websites with a.gov, edu, or .org domain extension, as these are generally more trustworthy. Check the date of the information. Health recommendations can change over time, so it is important to ensure that the information is up to date. Most importantly, if you have any doubts or concerns about your health, consult with a qualified healthcare professional. Remember, your health is your most valuable asset. By being informed and discerning consumers of health information, we can protect ourselves and our loved ones from the harms of misinformation.